It's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, hello. Welcome to Boomer Life here on CIL 650. I'm Sterling Fox with a couple of guests in studio from NeuroKinetics Clinic. Philippe Souvestre is the founder and president of NeuroKinetics, and Sonia Dheil is the clinic manager at NeuroKinetics Clinic, which, by the way, is in Vancouver in the Highcroft Medical Center at 3195 Granville Street. Dr. Philippe and Sonia, welcome back to Boomer Life.
Thank you. Good evening to you.
It's a pleasure to be here.
It's nice to have you with us. And let's start with the clinic itself. Dr. Philippe, it's your clinic. What does NeuroKinetics mean? What should we, when we hear the name NeuroKinetics, why should we remember it? Is it a medical word?
Well, it is, somehow. It is a blend, it is a combination of two words, neurophysiology, neuroscience, and kinetics in a sense of the science of movement.
Okay.
Which combined reflect very well brain physiology, which is the domain we apply our medical knowledge.
So it's about the brain and about motion.
Motion, dynamics, anything that is regulation, anything that is in motion and makes us, well, it boils down to the mystery of life.
Okay,
yeah.
All right. NeuroKinetics, it sounds like it would be a kind of a physiotherapy type operation, and it's much more than that, isn't it?
It is a good point. Initially, this word was constructed by myself in the late 90s. I was looking for a name for the new company to be when I moved to Vancouver.
Right.
And I came to that name, among others, as it reflects very well the mindset and the technicalities we are providing to patients to assess and treat them.
It also reflects your professional and academic background, doesn't it? You're a doctor. You're a flight surgeon in the French Air Force. You have all the medical training and schooling of any physician in Canada. And yet you've come to Canada out of your European background to try things different, to do things differently, and to incorporate into your work not only your Western medical education and background, but also other types of medicine and other approaches to medicine that typically aren't found elsewhere.
I must clarify that I didn't move to Canada to do new things. What I was doing already in France, I furthered it and enhanced it further.
Does the work that you're doing with your clients and patients from Europe, it carries on in Canada? You have patients not only from British Columbia and across Canada, you have patients from all over the world who come to Vancouver to NeuroKinetics. Why? What do you do that's different that these people are quite prepared to come to Canada from Australia, if necessary, to receive the kind of treatment that you offer?
Yeah. We blend Western medicine, Oriental medicine, and brain neurophysiology, which is brain neuroscience. This is a blend of my own background and put together into a medical or biomedical expertise.
On the program today, on this particular episode, in previous programs, we've talked about migraines. You were with us last month. You and Sonia popped in, and it was a fascinating discussion. And today, we're going to talk about depression and anxiety. And these are fairly commonly held. Everybody knows what they are. You can't watch TV for more than 15 minutes without seeing a pill for either or both. So we think we know a lot about depression and anxiety. Which of the two, Dr. Philippe, is the more urgent problem or condition? Or are they one in the same?
They are part of the same spectrum. Severity is the difference. Anxiety will lead to depression.
Okay.
Yes.
And now anxiety, you hear about athletes and performers getting anxious before they go on. The skaters or the skier standing at the top of the mountain just before he does the big Olympic run. The stomach is churning. You can't believe how nervous you are. That's anxiety. It's like the performer going out to give a concert, standing in the wings. The audience starts to applaud. The stomach churns. The nerves are all tingling. That's anxiety. But that's good anxiety, isn't it?
It is the it corresponds. Yes, it is. It corresponds to the definition of stress, according to Cellier, the neurophysiologist, which identified that stress was a good thing as it is a necessity for survival.
Sure. Yeah. Well, a performer, for example, will tell you the day he or she doesn't get that nervous stomach before stepping out to give that performance is the day that they really start worrying. They kind of rely on those nerves to give them that extra boost of energy.
It is a healthy mechanism that will optimize performance. Yes.
So where, Dr. Philippe, does anxiety go sideways? Where's the fork in the road from the good anxiety that assists us positively to the anxiety that can be debilitating?
The word anxiety as pathology is concerned, which is an abnormal state that would prevent someone to accomplish normal performance or affect health even, will begin when this definition will begin when performance goes down and symptoms rise.
Okay. Sonia, when people call down to NeuroKinetics Clinic and they have questions to ask, you are frequently, as clinic manager, one of the first people on the phones, you and your team. And when someone, do people identify when they call up, listen, I've got this real problem. I have high anxiety issues. Do they know that they have anxiety disorders of some kind, or are they just feeling confused?
A lot of time it's confusion. A lot of time it's the symptoms is what they give me. They say they have an uneasiness. They have a fear. They have, they're worried about certain things. It's certain things that after identifying when they do come in for the assessment point, sitting with Dr. Philippe is when we can identify that, yes, it's the anxiety. That's what's to the extreme side of things as what they have.
Okay.
Yes.
So anxiety in and of itself is it a brain condition? Is it a medical condition, Dr. Philippe? How would you describe it? How would a doctor describe anxiety?
I wouldn't say it is a condition. I would say it is a state.
Okay.
It is different. There's a big difference between a state and a condition.
Okay.
Anxiety is never alone to start with. It always results for compounding parameters that will become so adverse to healthy physiology and healthy mental operations that performance will begin to decrease and physical and mental symptoms, including emotional, will begin to rise.
I'm curious to this question for both of you, because when we're talking about depression and anxiety, we're crossing a line. Last program, a month ago, we talked about migraines. And migraines, while hideous and problematic, don't carry any other social baggage other than, gee, that's too bad. Migraines are terrible. But when you talk about anxiety and depression, you're crossing a societal line. Now you're talking about a gray area that some people would call mental disorders or mental health. And that discourages, in fact, it scares a lot of people away from dealing with their issues. And Sonia, you talk about people being confused when they call the clinic.
Yes.
Is some of that confusion resulting from, I don't know, am I going crazy?
Yes.
What's the deal?
Yes, because anxiety and depression are both categorized in the mental health,
categories. Sure, you bet. Yeah.
That. So, but if we sit back and just lay out the definition, it's anything related to emotional and functional challenges that an individual faces.
Right.
So, at that point, because it's categorized in the mental health section, therefore, when people call in, they're confused. They don't want to be in that little box and say, what do I have? Why am I in this box?
Right.
How can I deal with this? Am I ever going to get better? So that's how we go ahead and start with the treatment. First level 1 treatment process, when they sit with Dr. Philippe, is when we can actually go ahead and list out all the traumatic things in their life and say, look, this is where it started from. Let's start from, point A to get to point Z to get you to that point.
Right.
Yes.
But I guess, Philippe, what I'm after here, though, is the reluctance of so many people to come forward when they're dealing with these issues that may be perceived by some of their peers as kind of borderline, oh boy, she's losing her marbles here, this is not good. And so instead of proactively, aggressively seeking treatment and help, we run and hide because we don't want to be discovered as being possibly one of that group,
Yes.
those people. Oh boy. So I guess talking people down from their fears is a big part of those initial consultations, right?
Absolutely. It is actually one of the things we explore. We consider anxiety and depression as rather the tail end of an evolution.
Oh.
Spiral down.
Right.
Rather down the top of the chain, which would cascade down another series of ripples, whether physical or mental or affective. So it is a different way of seeing things, which ties with the recent knowledge about brain physiology and behavioral physiology.
I'm just looking for root causes, as seems to be the popular thing to do these days. And when it comes to anxiety, suppose now, and we hear a lot more these days than we ever did, certainly when we were in school, Philippe, but we hear a lot more about bullying, for example. So if you as a child were badly bullied in your school days, and that developed into a sort of a low self-esteem and caused you to create defense mechanisms so that you could at least get through school and get out. Could that be the beginning of a person's eventual anxiety?
It is one way to get there. Absolutely. It is not the only way.
Oh, no, I know, but what I'm looking for is how does this begin?
It is a good example.
Okay.
Yeah. Well, it ties with insecurity.
Mm-hmm.
It ties with fear. And fear is a complex phenomenon which will be very invasive on many layers in brain functionalities, affecting physical, affecting cognitive, which is perceptuality.
Yes.
So the ability to perceive things on many ways and to integrate those perceptions. Emotional side of things will be major. And it will affect also the intellectual capabilities and the executive capabilities.
So does one then develop this condition of anxiety, this because of external forces, Philippe, that you eventually you sort of retreat into this anxious personality, or is it sometimes self-induced? Must it always be external to cause anxiety, or can you do it all by yourself in your own head?
It can happen. Both actually are modalities to get into a very chronic anxious stage.
Okay, which is the more likely of the two? External forces?
Yes.
Okay.
Short answer would be yes.
Okay. And so, Sonia, when these people call up, and talk to me a little bit about, in addition to being confused exactly as to what is wrong with me, they also have you're not the first person they've called at NeuroKinetics, and in many cases, they've been around and seen various psychologists or psychiatrists or other medical practitioners and received perhaps a prescription or two, but no understanding or no ability to understand, first of all, what the heck's wrong with them, and some sense of direction as to how it might get better.
Yes, and the major, I would say the major thing is when all of our patients or most of our patients related with this condition call in is fear.
Right.
Is worry. They call in and they say, I'm afraid, the fear of why are they feeling this? Why are they feeling the extra emotions connected with something? Why
Right.
now? Why not before when this certain situation occurred, for example, if something did happen in their life? So it's just getting them to that point and realizing that mainly someone's there to listen to them.
Right.
Giving us a call and say, come on in, we'll sit with you for 30 minutes. Let's hear what you have to say to us. Let's move you on to our assessment process. We will sit with you side by side, get you through the process, provide you the support, provide you the ears that you do need, and provide you the comfort and clarity to get to where you need to get to.
Right. Okay. So again, and I suppose the fears, I wanted to ask you, are these fears of Internal, again, I don't know what's wrong with me, but I'm not on my game, and I'm really concerned that I'm starting to lose it here. Is that the kind of fear you're talking about, or are they afraid that somebody at the office is going to find out and I'll lose my job?
It's a mix of both, I would say. For example, it could be something as someone has, slipped and fall. They fell down maybe in a mall, and they're afraid to go back to shop in a mall again because they feel like someone will see them again in case they fall again.
Mm-hmm.
The simple things like that build up, that they isolate themselves from, going out to do day-to-day activities.
Are most of the fears, Philippe, before we take the break, and we need to, but I must ask this part, are most of the fears, as Sonia has defined people coming to you full of fear, are most of the fears self-induced? You're afraid of something because you're afraid of it, and it gets bigger and bigger and bigger, and it's not really a thing except in your head.
Yes and no.
Okay.
Yes and no. Most commonly, it is not in the nature of things to build our own fears. They come from a history. That history may be forgotten,
right?
May be blacked out,
mm-hmm.
may be compensated for. There is always a history, and this is why we have the process we have to analyze and approach this type of condition, because there's a history behind every single anxiety.
One of the things that we've learned over the months that we've been doing Boomer Life is that our friends at NeuroKinetics offer, above all, hope, an opportunity to be heard, to be listened to be assessed carefully, and to be put into a program of therapy and recovery that offers hope, and plenty of it. Lots more still ahead on this episode of Boomer Life with our guests from NeuroKinetics in the Highcroft Medical Building on Granville Street in Vancouver, and on your computer at neurokinetics.com. Lots more still ahead. Back after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650. We're back. This is Boomer Life on CL 650.
Welcome back to the program. We're talking about depression and anxiety with our guests from NeuroKinetics Clinic. The president and founder is Philippe Souvestre, and the clinic manager is Sonia Dheil. It's a pleasure to have you two here, and also we have another guest joining us on the line. Dorothy is with us from work, as a matter of fact. Dorothy, thanks for joining us. You're a former patient at NeuroKinetics, correct?
That's correct, and it's my pleasure to be here.
Tell us a little bit give us a little bit of background. What kind of shape were you in when you heard about NeuroKinetics? Why did you end up there?
I had fallen into a very deep depression after 20 years working in a high stressful job and many, many layers of trauma underneath that I was somewhat unaware of. And I came to the point where I knew I was going to have to call my doctor and check myself into the hospital, and I thought, oh dear, I'm already on antidepressants. Do I want more medication, or
right.
Can I find a slightly different way of finding this? And I was given the website address for NeuroKinetics, so I went online, looked it up, and went, I think this is more to my liking. So when I first came into the office, it actually took me 6 weeks to get myself out of the house and into see Philippe for the first time. And that became the beginning of life again for me.
The 6 weeks, Dorothy, sorry to interrupt, but I'm just curious because the 6 week time lapse, that was just a function of the depression, wasn't it? It just took you that long to sort of focus and energize yourself to the point where you could go do something, right?
Depression and anxiety.
Yeah.
Just to prepare myself to leave the house, to meet new people, to get into the car and drive.
So I'm curious, though, you talked about this condition of depression and reluctance to even circulate with the rest of the world. How did you go to work every day?
I hadn't worked for a number of years.
You just checked yourself out of the workforce, huh?
Yeah.
Wow.
A series of incidents. I had been working. A series of incidents happened over a 6 week period that just would have brought just about anybody to their knees, and the last one being laid off my job, and I just threw up my hands and went, okay, I surrender.
Right.
And then working with my counselor, we were trying to work through the depression that we knew I had then. And we kept on running into a brick wall. And I thought, I'm blocked somehow. Something's blocking me, and I've got to find. And that's why I knew medications were not the route for me.
Well, I was just about to ask you. You described yourself earlier as having been prescribed antidepressants. Did they do anything for you?
They kept me in the workforce for a number of years.
Oh, okay.
Yeah, I'm grateful that I had them for the period of time, and the relief it gave me. But there was more to it.
So you said you were at a point, literally at a fork in the road, where either you were going to check yourself into a hospital, or you were going to go find some alternative method of resolving this problem. So you were so. It was so debilitating psychologically and physically, Dorothy, that you felt you had to go to the hospital? You were just physically that run down?
Yes.
Wow. And that's just a function of not really having a lot of energy or purpose in life, it sounds like.
Well, it was a combination, I realized later, of, as I started working with Philippe, is, at least for me, there was an underlying number of layers of trauma in my life from a very young age.
Right.
That if it's not dealt with, your mind locks it away in a closet someplace, and you put enough layers of those, one on top of the other, eventually your brain is just not going to be able to deal with it.
I understand. So, Dorothy, before you went to Philippe and he began this elaborate process of unraveling all of these events in your life so that you could eventually have them out in front of you and go, oh my gosh, look what happened, and look at and the cause and effect relationship of all of these events. When you went to other medical practitioners, was that process of determining traumatic events or regressing to find out what went off the rails many years ago, was that ever even initiated?
No, I was dismissed. Most often, I was dismissed.
And you were prescribed antidepressants.
Yeah.
And what other remedies, if any, were offered to you?
None. I took my own initiative to find an excellent counselor who worked the best that he could to help me, but he can only do so much.
And was the counselor in question a psychologist, that sort of counseling type person?
He wasn't a psychologist, but he was extremely well trained.
Right. Okay. But still, but it's a medical thing. In addition to the psychology of it all, the depression, it physically, you were about to go to the hospital, Dorothy. You were so medically challenged.
I couldn't care for myself. That's what depression, if you go deep enough into it, you get to the point where you don't dress, you don't bathe, you sit in a chair for 12 hours a day, you get up, you go sleep for 12 hours, and you get up the next morning and you sit in a chair for 12 hours.
Dorothy, what sort of support systems do you have in your life, or did you have in your life during all of this? Did you have a spouse? Do you have children, family members, a roommate, anybody close to you that you could at least kind of share what the heck was going on?
My sister knew, and she was my lifeline. And there were a few other friends who were also aware, and they felt helpless.
And the other aspect of depression and anxiety that we're trying to zoom in on the program today, Dorothy, is the mental health nature of the problem, because it's seen as there's a stigma attached to anxiety and depression. You're seen as a bit of a mental health risk. Did you encounter that in your workplace at all? Were you very reluctant to share with any of your work colleagues any of this stuff in your life?
Nobody knew.
Right.
No, nobody knew, because how do you describe something you can't see? And I don't blame people, because unless you have a context of which that someone's explaining something to you, if you have a context that you can connect to understand, then people can have empathy and compassion for you.
Right.
But when they hear my story of sitting in a chair for 12 hours and sleeping for 12 hours, nobody can connect to that. so it's very difficult for people because you don't have a cast on your leg or you
Right.
don't have a bandage on your arm.
Mm-hmm.
And this is something foreign because there's been such a stigma attached to what they sort of call quote-unquote illness. I think of it as I now know, the connections in my brain weren't working anymore. And once they start working, then you go back to being who you are.
And that's Philippe's whole point. The depression and the anxiety, they're always much deeper than what appears on the surface. Correct?
Correct.
Right. And in some cases, I'm curious, have you got a second to walk us through? Sonia's talked to us in previous episodes of the program about what happens to a person when they call NeuroKinetics going, for goodness sake, please help. You've been there, you've done that. Walk us through what happened to you when you called.
When I called, I was set up with an appointment, and it was explained to me that Philippe starts with a balance test. And at that point, I just said, okay. I was willing to somehow just go on pure faith that this was the road that I had to take. So
Right.
when I arrived at the clinic, Philippe took me into his testing room and worked his magic. The man has a brilliant mind, and I'll let him explain to you what that's all about. But I could tell, standing in that room, my balance was off and my body was completely and totally out of balance. And he gave me the results at the end and said to me, Dorothy, I can help you. And that's all that I needed to hear. And I started sessions with him immediately, using different techniques. I was so sensitive to touch of any sort that it took him a little while to sort through his army of needles that he uses for acupuncture.
Oh, right, of course.
Until he found what I could tolerate.
Right.
And within a couple of weeks, I had a situation that showed me just how quickly changes could be made. At that point in time, I could barely talk to a clerk without bursting into tears. And a friend of mine called me in crisis and said, Dorothy, I need help. I have nowhere else to turn. And
Right.
This was a very close friend. And I thought, oh, can I help her? And as she was telling her story, I realized I'm not crying.
Mm-hmm.
I can deal with this. I can handle this. I was amazed. And I went, okay, this is really something.
And how far into the weeks of therapy and treatment with Dr. Philippe were you at that point when you realized this is working? I can actually be a benefit to other people. How far along were you?
2-3 weeks.
Wow, that is quick.
Yeah. I was expecting 2-3 months.
Yes.
Now, each person is an individual, and had that situation happened, I don't know whether I would have noticed it or been cognizant of it quite so quickly, but because it was a crisis, it showed itself that quickly.
Mm-hmm. So when you went and sought out Sonia and Philippe and the gang at NeuroKinetics Clinic, when you went there and realized pretty quickly that these people, A, were quite prepared to sit down and listen to you and put you through the assessment process and began to help you almost immediately, were you ever afraid when by the time you got to NeuroKinetics? Were you afraid of what people might think about you even in this new place? Or were you so far down the road with all of that stuff, Dorothy, you were just happy to get there?
I was just happy to be there, and I sensed with Philippe he's an incredibly compassionate and empathetic man, and because of my history of trauma, he had to know. I had to tell him all the stories.
Sure.
And he was the first one who listened.
And that's a big part of it, isn't it,
Yeah.
Philippe? Getting the actual life story of the individual who's come to see you. I mean, they've put themselves out. The very least you can do is hear their story, right?
Yeah.
Yes, and understanding the chronology of whatever has happened adversely is critically important
Right.
as well.
Right. Now, Dorothy, how long ago did this treatment program end at NeuroKinetics?
3-4 years ago.
Oh my!
I'm horrible with dates and times. I just know that life is. I have my life back, and
Right.
I know that I will never be in depression again.
And are there follow-up sessions that you need to do once a year or every 6 months or any of that stuff, or have they seen the last of you?
No, they've not seen the last of me. Because I find that once you understand how your brain works, you know when it's not functioning completely correctly, and you go in for a tune-up. It's not like they say, okay, we need to see you, Dorothy. Now, each person is an individual, so I can't speak for others. But, I mean, if I fall or I have a physical accident, one of the first phone calls I'm making is to Philippe.
Oh, okay. Because of the traumatic nature. Is it possible, Philippe, while we've got Dorothy on the line, is it possible to go through the program as Dorothy has successfully done and fall back? Do you need to maintain a certain attitude and outlook and, as Dorothy says, perhaps even show up for a tune-up every now and then?
Well, it's a matter of need. It is a matter of need, and under pressure we tend to get fatigued, and out of that we may slide away a little bit from a standpoint of brain controls, if you will. So I don't want to be technical here, but in short, is under the pressures, lifestyle pressures,
Sure.
Professional, occupational pressures, we tend to get fatigued and worn out once in a while, and if there is vulnerabilities, that would be where problems may begin to kick in.
Right.
So it is preventative as well as, repairing or fixing a little bit. And I forgive the technicality of the word fixing here, but
no.
Yes, it is that mindset. So it is on an as-needed basis exclusively.
Dorothy, only a couple of minutes left here, and we do appreciate your time and your courage in coming forward to discuss this with us. It's very kind of you. A lot of people listen to this program. This is Boomer Life. A lot of people who are 50 plus, and a lot of people who are at a point in their lives where the script isn't turning out the way I wanted it to be written, and that's really depressing. So talk to those people in terms of overcoming the fears and particularly the stigma, Dorothy, to get to where you are, to that, and I don't mean to sound facetious, but to kind of a happy place, if you don't mind my saying so.
Well, it is a happy place. And what I'd like to say to anybody out there is it doesn't matter what anybody else thinks of you. Who's important is what you think of yourself. And if things aren't happening or going the way you want them to, then this is the time to create that life for you. You can. You just have to make that decision.
Right. And once the decision is taken, however, whatever amount of time it takes to execute the decision, in your case it was about 6 weeks, it's time well spent nonetheless, isn't it?
Oh, it's given me back the rest of my life. And I couldn't even begin to imagine. And when your body is performing at peak performance, so is your mind.
Mm-hmm.
And you see the possibilities, and you can take those possibilities by the throat and just run with it. Whereas if you're feeling fatigued, you're feeling tired, and you can't even think of, I can't think of going back to schools.
Right.
Well, yeah, you can. And you can learn, or you can, create that garden in your backyard or travel the world. It's all there within you. All you have to do is have it unlocked again. It doesn't go away. It's still there.
Mm-hmm.
You just have to find a way to re-access it, and that's what Philippe does.
Wow. What a fantastic testimonial. I must say, you are a pretty impressive guest, Dorothy. Thank you so much for this. Wonderful to speak to you, and I'm so glad to hear you're doing so well.
Thank you.
My pleasure entirely. We need to take a quick break here on Boomer Life, but when we come back, we're going to ask our two guests, how did you do that? After this time out on CIL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650. We're back. This is Boomer Life on CIL 650.
Welcome back to the program. I'm Sterling Fox, joined in studio by Philippe Souvestre, the president and founder of NeuroKinetics, a clinic in Vancouver, and clinic manager Sonia Dheil is also on the program today. We've had a very moving conversation with a former patient of yours, Dr. Philippe. Dorothy joined us for a few minutes and discussed her situation, which was quite moving, actually. A woman who'd suffered for quite a long time from depression. But just before I'm going to get you to ask how, tell us how you got Dorothy to feeling so much better about her life and herself and all of that. But I wanted, first of all, to talk, as we did at the beginning of the program. We mentioned we're going to talk about depression and anxiety. The little homework here produced the following bit of definition stuff. Depression, rather. A state of low mood and aversion to activity that can affect a person's thoughts, behavior, feelings, and sense of well-being. When you have depression, it's more than feeling sad. Intense feelings of sadness and other symptoms like losing interest in things you enjoy may last for a while. Depression is a medical illness, not a sign of weakness, and it's treatable. This is a definition fairly commonly available to anyone with a Google machine. Do you agree with the definition, Dr. Philippe?
I agree with part of it, not all of it.
Okay. Where do you take issue?
In the light of my experience and what I have been learning through my career, I am convinced that depression shouldn't be considered as a medical illness.
Oh, it's not a medical illness?
Which is
it a psychological disorder then? Is that how you would categorize it?
It is a cognitive depression.
Okay.
In a sense, the processings that underlie mental activities, emotional state, are not working well.
Okay.
And it ties with a lot of physiological support mechanisms. It is mostly physiological. It is not as psychological as one would think.
Interesting, because now when Dorothy was describing her circumstances to us a few minutes ago, she talked about having gone to other medical practitioners and was given antidepressant prescriptions and not much else by way of not particularly a lot of attention even paid to her story or her symptoms. She came to you after learning about you. This is a person who's been depressed for a long time and was describing her typical day. I sleep for 12 hours and I sit in a chair for the other 12. That's my life, and had been going on for quite a while. Not exactly a sizzling kind of life, right? So she finally hears, after exhausting all her other avenues of inquiry, she hears about NeuroKinetics and decides, I'll give those people a chance. But it takes her 6 weeks to even coordinate the phone call, making the physical effort to call Sonia and eventually to come out and see you and your colleagues at NeuroKinetics. So that's pretty severe depression. 6 weeks to even pick up a phone, to make a phone call to your own benefit. That's pretty depressing, isn't it?
Yes, it is.
So now is that person's mental health at risk when you get to that point? Is that why we have this stigma associated with depression?
Yeah, I think you nailed the point very well.
Okay. So when this is the part of the story I am so looking forward to. Sonia and Philippe, collaborate, please help me. What did you do that made that woman that we spoke to turn her life around from an introvert who slept 12 hours a day and sat in a chair looking at the wall for the other 12 to the kind of extroverted, back in the game kind of happy person that she is now? How did you do it?
Well, as a Western medical doctor, I would have been unable to help her, being only a Western medical doctor. As an Eastern medical doctor, being only an Eastern medical doctor, I would have been unable to understand and help her. As a neurophysiologist alone, I would have been unable to understand her enough to be able to help her. It took those three disciplines put together to become able to help her.
And that's what you bring to the table with every patient, the ability to apply neurophysiology, Eastern and Western medicine in each individual condition.
That is correct.
Okay, so when she came to you, she talked immediately about how within 2 weeks you were able to source the traumatic events in her life that had caused the whole process of depression. That's remarkable, Philippe. How do you do that?
Well, actually, it took only 3 days to source it because it takes 3 steps of assessment to get the data we require to design the treatment program.
Oh, okay,
which
so this
lasts
is
12 weeks.
This is the 3-step, Sonia, that you've
Yes.
talked to us about in the past. There's that phone call.
Yes.
You and your colleagues take the call, and after the phone call, there's a series of 3 assessments,
Yes,
right?
the triage assessments.
The first one is the brain optimization consultation,
yes.
and then there are 2 more beyond that. And
Yes.
during those assessments, Philippe, you were able, just by conversation and technique, to identify Dorothy's issues?
Yes, interview and testing, basically, which means investigating her history, trauma history. I am a traumatologist.
Yes.
Medical history, of course, and lifestyle history are necessary to understand what has been going on, and also reversing the current state of symptoms, disabilities, issues, and emotional fears that always go along with this. It is a very complex situation.
Dorothy told us, and she really piqued my curiosity here too. She said, "Well, you know, Dr. Philippe starts his assessments with the balance test." I said, "Okay," and then she described what happened to her in her balance test, and she discovered her sense of balance was just way off. So tell us about the balance test and how important that is.
Well, balance test is a part of the investigation. It is only a small part, actually, but it seems to have made a strong impression on Dorothy.
Yes, it certainly did.
And actually very impressive when you see a patient nearly going to fall during a test which is only requires from you to stand, both feet side to side and closing your eyes.
Mm-hmm.
So it's very it makes an impression.
So a person who suffers from severe depression is likely literally to be unbalanced, and I mean that not in a mental sense, but in the inner ear physical sense.
Physical sense, certainly. Yes.
And so the lack of physical ability to balance oneself is simply a reflection of what's going on in your head?
Yes.
Wow. I didn't realize it was. Is it that obvious?
It is.
So,
it is not new, actually. That has been understood after the Second World War, actually. So it's a long time now, before even I was born, that the concept was understood.
Right. Can I just, because you just opened a door, and you're a former military man yourself, a flight surgeon in the French Air Force, here in Canada we see our soldiers and our military personnel returning from abroad from some pretty nasty places of deployment where we send them in our name, and then we seem to, give them a bit of a hard time when we find out they have depression and post-traumatic stress disorder. Is that a form of depression, Philippe?
It is.
Okay.
Absolutely, yes.
And when you have, and you don't, it's not restricted by any means to members of the military. Our firefighters and first responders, paramedics, police officers, people who encounter traumatic events on a daily basis are prone to this condition, are they not?
Yes.
And how is it best treated? This is something that I think the government of Canada could probably take a lesson or 2 on. We seem to be pretty bad at it. What would you do to a person who comes to you suffering from post-traumatic stress disorder?
You are very judgmental. Nobody is bad here, but it is. I have.
I
lots.
regret the treatment that some of our military people have not received. That's where I'm being a little judgmental. That's
No,
all.
and I was teasing you a little bit here. But I understand the complexity of this, and it is a matter of a school of thinking.
Right.
You know, I come from a background and a country, France in particular, where the mindset and the vision of medicine is extremely different compared to the Canadian way of envisioning medicine.
Okay.
So it is. I was born in France. I didn't ask for that. I didn't choose it. So we are born wherever we are born. But the good thing is, I am a traveler. I am a citizen of this low world rather than a citizen of a country. I am a proud Canadian citizen. Don't misunderstand me here, please.
Uh-huh.
But this said, I belong to this planet, and I am trying to see and identify the best everywhere I can see it,
Right.
and put this together. So it is. I have seen that sometimes mindsets and way of thinking, ways of approaching a particular complex issue could make a difference. You know, there are good angles of approach. There are poor angles of approach.
Right.
Not to say bad angles of approach.
Right.
So it ties with this.
But one thing that Dorothy said, Sonia, and I think it's really important, is that, every person is different.
Yes.
There's not a one-size-fits-all approach to any of these issues ever, is there?
Yes. Yeah, and this is why I agree with her as well. And this is going back to the explaining the sessions, the three triage of assessments.
Right.
The reason why we do them, as opposed to having a base or a flat rate of this is how we treat concussions, this is how we treat depression. Everybody's different. Everybody has their own individual results. This is where we take the measurable data from all of the triage assessments, take them, make their own customized treatment program. So this is why we are a little bit different in how we treat different conditions in our clinic.
And the big difference, of course, is that NeuroKinetics, above all, offers hope to people who just need help. There is help, and there's a lot of hope out there as well.
I would disagree with you. We don't sell hope. We build it.
All right. That I can handle that sort of flack from the sidelines. No problem at all. We're back with lots more. We're talking NeuroKinetics Clinic. And by the way, you can find them in the Highcroft Medical Center building. And that's right there on 3195 Granville Street on the way up the hill out of town.
Yes, there it is.
And online at neurokinetics.com. And we're back with more right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650. We're back. This is Boomer Life on CIL 650.
Welcome back to the program. Sterling Fox joined in studio by Philippe Souvestre, the president and founder of NeuroKinetics Clinic in Vancouver. And Sonia Dheil is the clinic manager, also in studio with us. And Sonia, during the break, you were mentioning something that I think is really important. We're talking about depression and anxiety issues. We had a wonderful conversation with one of your former patients, Dorothy, a few moments ago. And we began the program talking about the stigma, the societal stigma, the baggage that having depression and anxiety issues carries. And a lot of people avoid assistance or seeking help because they're afraid. And you've said that. A lot of people call you up confused and afraid.
Yes.
And one of the things they get afraid of, because depression causes weirdness, imaginings in your mind, one of the things they're afraid of is being judged as borderline nuts or something like that. And they don't want to be. They want help. They don't need a finger wagging or a judgmental scolding.
Yes.
So how do you handle people who call up fearful and confused?
Well, we have a great support staff system. All sets of ears, eyes, there to sit there, hold their hand, listen to them throughout the whole process of them coming into the clinic. Mainly with depression, and it can get to the more severe side of things, is if they don't have or they don't feel they have somebody to speak to. Mm-hmm. And it's based on the fact that going back to being judged.
Sure.
They don't want to be judged. They don't want to be categorized into the whole, mental illness side of things.
Exactly.
So when they do come in, I do let them know that everything is kept confidential.
Mm-hmm.
Anybody, they don't want us to, nothing is anyways released. Personal information is not released of all patients. So when they do come in, they can sit with any staff member, sit side by side, sit with Dr. Philippe, or sit with somebody else of the staff member that they feel a connection with.
Sure.
And just release all that the traumatic stress off of them, and speak with someone side by side, and speak with them throughout their treatment process as well. Because everybody there is non-judgmental. That's
Right.
what I want everybody to know. We're here to help. We're here to support you. We're here to lend you a hand. So whenever they're ready, give us a phone call.
Professional and positive people, upbeat, positive people, always smiling. They're very, very energetic. Philippe, only a couple of minutes left, and I wanted to come back to something that you had stopped me on earlier, and the whole matter when I read that little definition and included depression is a medical illness, not a sign of weakness, and it's treatable, and you took issue with that. You said, no, it's not particularly. Why?
It is not a medical illness. This is what I have been learned. I was trained at medical school that in that depression was a mental illness.
Right.
It is not.
Okay.
No. With the integrated body of knowledge I have learned through time, and the design of stimulative techniques we use, it is the proof in the pie that actually depression, which reacts very well to such a treatment, cannot be an illness.
Right. Now, depression can create such a stressful condition in one's mind that there are medical consequences, correct?
Correct.
But it's not in and of itself that
No.
depression is the medical illness.
Not in itself.
Interesting stuff. I think most importantly, friends, what we're trying to do here with our capable friends from NeuroKinetics Clinic in Vancouver is let you know that there is non-judgmental professional help and oodles of hope available. All you need to do is seek them out. And if it takes you a few weeks to get that organized, as was the case with Dorothy, the best 6 weeks she ever spent getting up the courage to pick up the phone and get started. And that's what we're encouraging you to do as well. NeuroKinetics.com is the website. You can find them in Vancouver in the Highcroft Medical Center building at 3195 Granville Street. Sonia and Philippe, thank you so much for coming by. It's been a fascinating hour.
It
Thank
was
you
a
very
pleasure.
much.
And we'll see you again next time right here on Boomer Life.